Good morning, this is Dr. Rutledge. I'm going to talk to you today about the kidneys, and I apologize, I'm riled up. So let me share my screen. And good, kidney health. Your kidneys are dying. Let's try to save them. So a friend of mine went to her doctor and got told that she had poor kidney function, but not to worry about it. And I'm bothered by that. When I get bothered, I do a video. So let's go. All right, this is what happens to an aging kidney. So these are all the bad things that happen to us. And so it's listed here, vascular changes, that's the blood vessels. There's fibrosis, there's cell senescence, that is the cells get old. There's inflammation and a lot of things, and there's what's called oxidative damage. And what this does is a lot of things, but I'm going to talk mainly about the glomerular filtration rate. What that means is a certain amount of your blood every minute goes through the little small sieves that are in the kidney, which clean out the junk and allow the clean and cleaned up blood to get back out there. And that rate goes down over time in America in particular. And so a lot of people say, well, it's just aging. And I don't think that's right. And my friend's doctor told her, nah, don't worry about it. You're in stage 3 kidney failure or kidney dysfunction and nothing to do about it. Don't worry about it. We've been watching it. And so I was a little grumpy about that. So I did this slide presentation. And first, we're going to look at a clinical practice guideline from a couple of years ago by an international group, and just look at a couple of things that they say here. One of the things is there protein in the urine? And my friend hasn't had that tested. And it's an important part of the decision making. So that bothered me. I think we should test her urine. It's really cheap. I told her we can do it by ordering some test strips from Amazon. But basically, the other thing that was measured, a blood count, was that she has a grade 3A glomerular filtration rate. And normal healthy people have a glomerular filtration of over 90 cc's or 90 milliliters per minute for your body surface area. And and instead, what we have here is that her number is between 45 and 59. It's about 50. So mild to moderately decreased. And so mild doesn't sound too bad. Moderately, maybe a little bit more. And the doctor said, basically everybody's on the road to death, which everybody's kidney is getting worse. And I don't think I agree with that. And there's not really anything to be done. So, okay, well, I don't know. And this is what they say should be done in this particular older instructions or guidelines. They say people with a GFR less than 60 or markers of kidney damage, if the duration is greater than 6 months, then follow the recommendations for chronic kidney disease. So let's see what that says. And there's a bunch of things here, which I'll skip over. But again, she's in this range here. And depending on how much protein's in her urine, she could be yellow, orange, or red. Of course, she'd prefer to be green, but so that wasn't done. And so I think she should have her protein tested. And this is a study. Basically, it said if you had more protein in your urine, you were sicker and more frail. And you don't want to be frail. You'd rather be robust. So I think we should test her urine. But I'm not angry or anything. But I mean, they said, nah, nothing needs to be done. Anyways, so the recommendations are get a GFR, which hers is low. And it says check for albumin or protein in the urine, at least annually, to kind of keep an eye on things. And so we haven't done that as far as I know. Maybe it's been done and I just don't know about it, or she doesn't know about it. But anyways, the definition then is a certain eGFR if it's declining, and if there is that decrease, then that progression should lead us to consider what should be done. And so one of the things that might be done is protein intake. So in this consensus guidelines, they said we suggest lowering the protein intake. And her doctor didn't say anything about that, said, nah, don't worry about it. And we suggest particularly avoiding a high protein intake. There's a lot of people talking about the high protein keto diets and a lot of meat and protein powders and stuff like that. And this wasn't brought up, and yeah, don't worry about it. The other thing is, of course, you want to control your glucose and have that measured and make sure it's low. And you want to cut back on salt intake. And they didn't really say too much about that either. And I think it's really important. And so does this guideline. You should have your uric acid checked, because sometimes that can be a contributor. And that might have been checked. I don't really have the details on that. So, and they recommend lifestyle. So this should be walking, trying to control your weight, stop smoking, things like that. And again, I probably don't know all the details, but I don't think we got that kind of advice. So I'm concerned. But additional dietary advice, they recommend an expert dietary advice in the context of an education program. You should talk about cut back on the salt, beware of phosphate and high potassium foods, and talk about protein intake. And so I think all those are appropriate for these guidelines, and I think that should be done for most people. That's where I'm getting this. Anyways, let's move this down a little bit. This is from a recent study, longitudinal effects of aging on plasma protein levels in older adults and its association with kidney function. And what they found is the majority of proteins that they tested were increased in older adults, and the increase in protein levels was directly associated with the degree of reduction in the GFR by the majority of proteins. So again, this wasn't really discussed with her, and she kind of brought it up and not much was said, but I think that at least you should talk to your doctor and maybe the kidney specialist about the possibility of some of the research saying that eating a real high protein or keto type diet can be dangerous or even deadly with people who have kidney dysfunction. Now, I don't think you should go on a no protein diet. There's a lot of the keto people get wound up and say, no, we didn't say that. We said just avoid it. I don't know. But anyways, I'm concerned. So should renal function be carefully followed in the older adult? Yeah, of course. What tests should be done? Well, I think that we should see the blood urea nitrogen, BUN, the creatinine, the eGFR, the uric acid level, the CBC, LFTs, and unquestionably, we should see the urine protein levels. Now, what happens if you look at proteinuria? Basically, proteinuria predicts bad outcome. So in other words, for older patients who had an elevated creatinine, the more protein in the urine, the worse they did. And it was not much different than a young person. So I think we should measure the protein. Okay, now, what do we have about diet? Both the doctors kind of said, well, you know, and I'd like to point out that there are some studies showing that as far as diet and the function of the kidneys, there's pretty good proof that eating a better diet might protect the elderly patient's failing kidneys. And is there any possible reason to withhold this data from a stage 3 renal failure patient? I mean, we're saying eat healthy food, which is part of the American Heart Association diet recommendations. So why would you not just include that in this person who has stage 3 renal dysfunction? So I'm going to talk about one big study, and then I'll be quiet. But basically, there's a development of the food-based Lifelines diet score. This is a large-scale study in over 100,000 patients. And what they did is they looked at kidney function along with other things, but they looked at kidney function based on what people ate. Okay, let me just say that again. They looked at kidney function based on what people ate. Well, okay. I mean, that's what we'd like to know. I mean, is there a possibility that if you ate better, you'd have better kidney function? And we'd like to know that. So here's a study that shows it makes a difference. Here's what they found out of their 100,000 people. They measured what they ate, and they found that if you ate more vegetables, fruit, whole grains, beans and nuts, fish, oils and soft margarines, that is, you know, not from animals, unsweetened dairy product, coffee and tea, they found that they had less deterioration in kidney function. On the other hand, they found if people ate more red and processed meat, butter or hard margarines, that's animal kind of grease, and sugar sweetened beverages, that your kidney function got worse. And they couldn't go into detail on these other ones on the right. So I'm not going to talk about that. But in other words, if you had bad kidneys, if your kidney function fails, you go on dialysis, and not too long after dialysis, unfortunately, I'm sad to say, you often die. And this study shows, as we'll see, that if you eat vegetables, fruit, whole grain products, legumes, nuts, fish, unsweetened dairy, you can do better. All right. So this is the LLDS and Lifeline's diet score. I guess they didn't know about the Latter-day Saints in the States in the United States because might not have chosen that name. But anyways, figure one, we're going to see association between the diet score and the incident chronic kidney disease and decline in the eGFR of greater than 20%. So they said, let's look at how much they follow the diet, either eating healthier or avoiding bad foods, and see what happens to their chronic kidney disease, whether they develop it from the beginning when they didn't have it, or if their eGFR decreases by more than 20%. Both of these are really bad. And so the black line is the adjusted odds ratio if you eat more healthy food. So let's look at it. Again, these are the healthy foods, just to remember. And these studies have been shown in these foods have been shown in other studies, they're good for you. I mean, more vegetables, less coronary heart disease, less stroke, less diabetes, particularly green leafy vegetables, less colon cancer, less lung cancer, lower blood pressure, lower LDL, and well, they didn't get a change in body weight. More fruit, heart disease, stroke, diabetes, colon cancer, lung cancer, systolic blood pressure, whole grains, oats mainly, nuts mainly, fish helped with coronary heart disease and stroke, oils and soft margarines help with coronary heart disease, unsweetened dairy, yogurt helped with diabetes and colon cancer, and coffee, pretty good, and tea. Okay, so those are good, and this is how they worked it out. But now let's look at the whole group. All right, so if you ate more of the diet, that's to the right-hand side, then the line which showed how many people got chronic kidney disease went down. So let me say, if I say this a couple of times, eat better, get less risk of damage to your kidneys. Eat better, get less risk of damage to your kidneys. So why wouldn't you, if you wanted to? I mean, some people are, live free or die. I'm going to have my hamburger and French fries on my motorcycle without a helmet. That's cool. But if you're saying to the doctor, is there anything that might help? Seems like to me you could say, well, you could eat healthier. And this study, and this is not the only study, but I mean, come on, what do you want? And this is their eGFR. And the eGFR tends to go down as you get older, but these people had less of a decline if they ate better. So I don't get it. Why don't we eat better? Okay. Anyways, so the same thing again, associations of the Lifeline's diet score and chronic kidney disease getting worse, or the GFR declining by more than 20%. And basically, you get better if you eat better. Okay, vegetables, fruit, whole grains, legumes, that's beans and nuts, fish, unsweetened dairy. And you can have a little coffee according to this. And just don't eat red and processed meat, butter, and sugar sweetened Coke. All right. Anyway, so there's moderate amount of proof that eating a better diet might protect the elderly patient's failing kidneys. I didn't give you all the articles on it, but it's pretty good. And is there any possible reason to withhold this data from a stage 3 renal failure patients? I mean, anyways, that's all I wanted to say. And I'll stop it there, and hope all of you have healthy kidneys.